Greetings, everyone. Hello, everyone. Welcome. Greetings. Thank you for joining us today for our webinar today. And welcome. My name is Dr. Gary Smith. For those of you that don't know me, I'm the president of the Faculty of Homeopathy. And I'm delighted to see so many people that have joined us today. This is the seventh event, the seventh part of this series working on what works in homeopathy. And as most of you know, the Faculty of Homeopathy is based in the UK.
Oh, sound's gone.
I think I was silenced there. Can you hear me? Great, I'm back again. Yeah, the Faculty of Homeopathy is based here in the UK. Vithoulkas Compass is based in Greece, but we both have operations and members internationally. And it's been really wonderful throughout this series to see colleagues from right around the world and people popping the country of origin in the chat box and previous events. And I can see, looking down the list, there's a real global participation in this event. So that is really tremendous to see. So thank you very much for joining us from wherever you are in the world. This event's being recorded, so the recording will be made available afterwards. So if you're watching us on that, then you're very welcome, and thank you if you're joining us live today. As I say, this is the seventh part in this series, this collaboration between the Faculty of Homeopathy and Vithoulkas Compass. And I would just like to say I'm very pleased to be collaborating in this way and providing sessions like this. And thank you to our friends at Vithoulkas Compass for your support of the Faculty of Homeopathy. As you know, our speaker today throughout this series and today has been our good friend Andrew Ward, who's well known to most, if not all of us. And Andrew is the UK ambassador for Vithoulkas Compass and is a very, very busy practitioner, having been in practice for over 30 years in both the NHS and the private settings. And he's also busy in homeopathic education as well, and over a very long time has been dedicated to raising the standards of both homeopathic practice and homeopathic education over the years. So we really have enjoyed Andrew's presentations throughout this series, and I'm looking forward to today's presentation as well. Today, his subject will be a case of grade 1 endometrioid adenocarcinoma and endometrial cysts treated with classical homeopathy. And these are, as you may know, these are really challenging, extremely challenging conditions to treat, whether conventionally or homeopathically or by any other means, extremely challenging conditions to treat. And Andrew will be showing how the correctly chosen homeopathic medicine can have a real profound effect and lasting healing effect. And in particular, showing how using the Vithoulkas Compass software can be helpful in choosing the prescription, both initially and indeed follow-up analysis as well. And I haven't seen the case, but I'm looking forward to hearing it. The one we talked about at our last event was one that really did merit writing up and publishing, and there've been high quality cases throughout this series and really encouraging cases. So I'm looking forward to this one. So I hope you find it interesting, informative, helpful. Please do pop your questions in the chat box throughout the presentation, and we will put those to Andrew after the presentation's over. Great to see everyone saying hello in the chat box and where you're from. A real global participation, which is great. So I'll say no more at this point, and simply thank you once again for coming. Enjoy the session, and over to you, Andrew.
Thank you very much, Gary. Thank you for your generous and lovely introduction as usual, and thank you for the support of the faculty. And I'm very happy to be collaborating with such an esteemed organization as the faculty. I know you have your 100 years, I believe. You're celebrating next year, and well deserved. And I think also the collaboration with Vithoulkas Compass, which is fantastic for me. It's a program that I find invaluable in my practice, and I hope this will be interesting for everyone. This case came to me in October of 2020, and this was a case I did over video. Never actually saw the patient in the flesh, as it were. I believe the patient was in Scandinavia, and this kind of case is very difficult when we're presented with such a presentation. But grade 1 carcinoma, it's not always something that we can help, and often I would say we don't often get the opportunity to treat such a case, because I would say normally people would be going down the conventional route. Sometimes we get asked to help with side effects of treatment or post-operative treatments, this kind of thing. But actually to treat the case is, in my experience, more unusual. I'm not a specialist in cancer treatment or anything like that. But the opportunity came because she didn't want conventional treatment. She was very adamant about that, and asked me if I would help. So I said, okay, we will try. You know, cancer is not something we can claim that we can cure in homeopathy. It's some cases respond to homeopathy, and so we have to just say, well, we can try and see. Now, this lady was 45 years old, and when she first came to see me in October, she hadn't yet had the diagnosis. So she was complaining of mainly some changes in her menstrual cycle, which were very strong period pains had started coming in the autumn of 2020, with colic-like pains premenstrually. So before the period started, the pains would come, and also going on into the period with a lot of heat, perspiration, and fainting. So very, very, very severe, to the point she might faint, with pains that were worse any kind of pressure. She would have to be in bed for about 5 days. So this was a big change for her. And they had done some scans, and they showed that she had 5 cysts on the ovaries, and they could see something in the uterus. They said, oh, looks like a polyp, and they would like to do a biopsy to check what's happening. So this was the first consultation, and we hadn't had any details about the diagnosis. She'd had some breast pain history before periods, but that was all really that had been wrong. Now, at this point, I asked her about her story, about why or how things had changed more recently in her life, because there had obviously been a change in her endocrine system. So she told me this story of some strong emotional conflict. She was married, but she'd been in India for some months, I think maybe 6 months, and doing retreats and things, and she'd fallen in love with a man there in India whilst traveling. And because her marriage was, she felt, not of that type, it was more a marriage of convenience. She had a very, very passionate affair with this Indian man, very intense and physical. And then she had to return to her country. So this was all stopped. And then she, of course, had this tremendous conflict. She was back with her husband. So she was suffering from really a grief at this point, after such a strong thing, and which then had to stop. And then she was away from him. So she was conflicted strongly on an emotional heart level, but also, of course, the endocrine system had been imbalanced because her, if you like, her intimate life hadn't been there for some years before, and now it suddenly woken up. So the whole endocrine system was very active, hormones. So a mental emotional state was one of tremendous grief. She was also tremendous anger, very angry, cursing, swearing a lot. She couldn't believe, cursing like a trooper, as we say, and feeling torn up inside, fearful, feeling very insecure as she relied on her husband for everything. Didn't want to tell him what had happened. Feeling very aggressive, and had got into an actual fight with a girl recently and deliberately hurt her in a fight. It's a tremendous anger. Fears were very strong fears of injections, needles, dentists, and pain. So very, very strong fear of being attacked herself, but also tremendous aggression to others at the time. From the fear of pain so much that she could faint from pain. Feeling very needy and scared and insecure, and then becoming aggressive, and of course not knowing what to do. Feeling very cold, but having a thirst for cold water. Family history. There was a lot of, her sister had some precancerous cervical cells. The father's mother had breast cancer. There was a great-grandmother who had throat cancer, some diabetes, and a lot of heart attacks in father's side. So quite a mixed history. Vaccines. She'd had all the usual vaccines as a child in the 70s, and also Hep A, B, rabies, and tetanus because of traveling, which she did a lot. Medical history, she'd had measles and chickenpox as a child and high fevers.
Someone was start sharing the screen. Cannot see who it was. Okay. It should be okay now.
We're back.
Yeah.
Sorry about that. Technology glitches sometimes happens. So so I was going to say what's very important, as I've mentioned before, in treating in chronic cases, is to look at the fever history to see what kind of prognosis we have for a case. For those of you not familiar, we're talking about the levels of health idea of Professor Vithoulkas, and what we can see, just to briefly summarize it, that if a chronic case still has the ability to have high fever, we're talking about high fever over 38.5 degrees Celsius, then the prognosis for that case is better than if the patient has not had any fever for many years, which puts them in a much lower group and in a more chronic position, state of health. It's a much more difficult task to get them cured and better. So this is why we see sometimes cures of cancer in patients that are in a higher level of health, because they have that possibility to recover. And that's true of all methods, actually. So not just homeopathy. If the patient is actually quite a healthy person and develops a cancer, then they're able to recover with different therapies, which we see. We see cases of people using diet, very extreme or vegan diets, all sorts of different therapies, and even conventional therapy. Of course, there are cures of cancer that happen in certain patients. They recover. But I believe these are all the same group of people, whichever treatment modality is used. It's to do with their ability to recover. Whereas the majority of cancers seem to be mainly incurable. So, and this is to do with their ability to get better. So we have to ask in the beginning and try and fix where their level of health is to see how difficult our task is going to be. And her fever history was that the last fever, high fever she had was in 1996, 24 years previously. So this puts her in what's called group 3, in a lower group, much more difficult to get a result, a cure with this. So we have to be aware of this, and also the fact that we need to see that fever coming back as proof, as evidence of somebody's recovery. It's not enough to just say, oh, I'm better, and this is gone, and those symptoms are better. We need to see this fever return, and it may be months or years later that this happens. Then we know that they've changed group and they're now out of danger, for instance, of the malignancy returning, which is often the case in cancer. So it's not just a matter of taking it away. We have to look at their future, the coming 10 years, to see whether they're really cured. Okay, so I will show you. Now I will share my screen. If you can see that. What is this? Put that down the bottom. Okay. So this was the initial repertorization I did with her case. Remember, at this point, we didn't know her diagnosis. She was having a lot of period pains. Oh, I put it in there. That's strange. Anyway, I don't know why that's in there. That's okay. Results. So what we saw with this repertorization is lacusis coming up first, Hepar-sulf, oral muriatic of natrum, silica, white lacusis. She had also this strong symptom of, particularly in the past, of things being worse before the period and then much better once the menses, the period had started. As soon as the flow starts being better, which we know is a strong lacusis symptom. And we see here some other symptoms. help us solve. Covering her mental symptoms more. I felt at that time she needed Hepar-Sulf because of the state of anger that she was feeling. We can see here, even in the representation, we go to this icon here, we can see immediately the materia medica, so a very nice feature in Compass. And you see here how she was presenting was this rather abusive, oversensitive to pain, angry person with pain, a tremendous pain. So Hepar-Sulf was what I decided to give her to start with. And I gave her a single dose of 1 m in the morning and 10 m in the afternoon. So split dose, but change of potency. And after this, she got the diagnosis actually. And well, it was confirmed anyway. They knew something was there, but they confirmed the malignancy. So of course she went into a real state of shock and fear. Also, they revealed these 5 cysts, 3 on the right ovary and 2 on the left. And on the 25th of November, for the follow-up, what transpired after the Hepar-Sulf was the next period was much better. So it dealt with the period, much less painful than before. But then now we had this diagnosis. I just want to share with you this is a summary. This case was put forward for publication a year ago. We haven't had an answer yet. If I can show this, I don't know if this is that better? Maybe, yeah.
Yes, Andrew, readable now.
So this was just a summary of the publication that we put forward. Okay, just to give a little bit of a summary. Let me see if I can do this. Okay, if you can see that. This was a translation of the actual biopsy. You see 25th of October 2020. I can't actually read this because, hang on, let me minimize this. And then make that bigger. Okay. This thing is in the way. Put it down there. Okay. Okay, better. Here you see, yes, FIGO grade 1, endometrioid adenocarcinoma grade 1. Another patient department, medium size, complex atypical hyperplasia, highly differentiated adenocarcinoma. So here you see 30% high content estrogen receptor. squamous cell metaplasia. So here we have the biopsy results. Okay. So let's go back to our repertorization. So at this point, I changed the prescription to try to find something that would deal with her, because she was in a panic, but she didn't want, they were of course saying, well, we have to go for surgery. This is the protocol for this type of cancer, is full hysterectomy. She didn't want hysterectomy, so she wanted to continue. So my next prescription I used the same analysis actually. Was aurum muriaticum natrum. Now, you may not be, all of you, familiar with this remedy, but it's a remedy that I came across when I was studying in Greece with Professor Vithoulkas. He presented several cases, and I then had several cases myself, and understood the remedy from his teaching and also my experience. And we do have some materia medica of this remedy. It's interesting, this very important remedy in this kind of pathology. And I remembered this remedy, and as I told you, our history was exactly this. So we see it acts on the female hormonal system, fibroids and tumors, ailments from disappointed love, depression, many fears, insecure people. Remember, she mentioned several times how insecure she felt, with strong sexual desire. And we see here it says it affects sexual hormonal balance, increased sexual passions in women, if not satisfied, increases fibroids and tumors. As the desire diminishes and becomes deficient due to suppression. Indurations of ovaries, carcinomas. So a very interesting idea came to my mind, that perhaps this was a case of aurum muriaticum natrum. We know this remedy is really like a mixture of natrum, mur, and aurum, remedies that have tremendous grief, silent grief, and depression. But it's the way it affects the hormonal system. And her focus of this was the story that she'd had. Her libido, if you like, was suppressed for many years. Then it became very active in India. Then it got shut down again. Then the tumors formed. And this is the idea of aurum muriaticum natrum. All that energy has to focuses inwards and forms tumors. So I prescribed aurum muriaticum natrum 12C. Let's see here, 12C, and we can see prescription details, and once daily to take. So that was on the 25th of November. On the 16th of December, so 3 weeks later, she described having a very nice dream after the remedy. She was part of a very happy family, which hers wasn't at all. And then a tiger came to the door of the house and then left. she described having more energy in the evenings, but she started to feel some different symptoms. One was, like she said, I cannot sleep on my left side anymore. It's feeling uncomfortable. She was feeling a constriction in her throat with a dislike of collars. She had to open here. And then with her period, very much strong PMS, premenstrual syndrome, physical and emotional, all of which were much better as soon as the period started. This is something that she'd always experienced, but become stronger recently, especially in the last month, the last period. So mood very down and low and irritable, and breast pain. Also, she had a jealousy dream 3 times dreams of jealousy about the man that she had met in India. And also some aching in the ovary region. So here we see a repertorization. She's much worse in the mornings, better with the flow of the menses. I didn't put the throat symptoms, but we remember before in the previous repertorization. Let me show it again. Vithoulkas is coming up top already. And probably someone will ask me why I didn't give it in the first place. It's a good question. But it's a question of timing with homeopathy. And actually, we will see that she needed this first and then glycosis. Of course, it's hard to answer the question of what would have happened if I'd given it first. A prescription. So we see here glycosis. So that was the next prescription, was glycosis 200C, morning and afternoon, 1 dose morning, 1 dose afternoon. And then the next follow-up was in January 21st, so a month later. And what had happened is she expelled after the glycosis a huge chocolate cyst. So one of the ovary cysts was expelled, they call a chocolate cyst, was discharged from vagina with a lot of blood. Was feeling hopeless about her condition and the cancer, very afraid, still doesn't want hysterectomy. Big fear of cancer, of dying now. Very strong sexual desire, still there. Wanting warm drinks. Able to sleep on her left side now, so that had changed again. And a desire to dance. She felt the only time she felt free and happy and better was when she was dancing. Meanwhile, the hospital had been pressurizing her again to go through their protocol, which was the hysterectomy. They booked in times and she was cancelling these times. So she was under pressure. So I prescribed again carcinosin, this time in January, 200, 1 dose. Let's see analysis. I think it's similar repertorization. Let me see carcinosin. So she described further information about herself being very oversensitive to criticism and the fear of cancer, strong desire for chocolate, for instance. and also some history. Xiphoid soup had come up. This is an interesting symptom that came suddenly. We don't see many remedies in this rubric, but we see carcinosin. So strong desire for soup had started. And also a history of, she'd had very, very difficult upbringing in childhood, with a lot of control and suppression. So the story we know with carcinosin being very, we see here again, very emotionally oversensitive, sensitive to comments, criticism. She was always somebody, she said, wanted to please everybody. History of suppression and this kind of thing. So an absence of fever, of course, we know sometimes carcinosin can be indicated. So that was the prescription. And the follow-up was in, what happened then is I lost touch with her after that. For a couple of months, she didn't get in touch. And then she said after the remedy, she felt that the carcinosin had touched a deep core in herself. Deeply wounded feelings emerged, and she cried for days, 4 or 5 days, she cried constantly. So there was really a big expression of grief. She said it was like an open wound. And then she said she didn't want to say to me, she said, I'm sorry, under the fear and coercion of the doctors, she had the hysterectomy on the 1st of March. But what was interesting is that after this, she developed a high fever of 38.5. So after the carcinosin, that is. For a short period of few days with a cold. So this tells us already that the person has had some very major shifts. So I was quite hopeful, and they said they would do a post-operative biopsy on the uterus, and we'll do a new share again. This one. And here we have the post-hysterectomy examination, 24 February. I said March, didn't I? It was February. February, obviously. And so we see here lymph nodes, no signs of metastasis, lymph nodes, none of them. And we see endometrium, atypical hyperplasia, no remnant of carcinoma. Conclusion, patient who had been diagnosed with endometrial adenocarcinoma preoperatively on biopsies, grade 1, current preoperative had no remnants of carcinoma, a few focal points. Yeah, so this was an interesting result. Unfortunately, she had already had the hysterectomy. It's difficult. It's always a difficult decision, and she felt that, of course, there was no way of them telling before they did the biopsy. So it revealed this result afterwards. So let's go back to. Also, they found that 3 of the endometrial cysts had gone, and 2 were diminishing. So they said in the process of resolving, almost gone. So the 5 cysts also gone. She said that she asked the surgeon now if she believed in homeopathy, and the surgeon said, I guess I do now. and laughed. And this was her first fever in 24 years. It shows the fact that she'd moved up in her level of health. So it's an interesting case. We can't say exactly which remedy. We can say maybe, oh, which remedy helped, we don't know. I believe all the prescriptions were useful. The aurum muriaticum natrum and the lachesis particularly. Just to show you something else I forgot to show you. Let's just put it here. I've shown this feature before, but because some of you may not know aurum muriaticum natrum, and it may be very difficult if you don't know the materia medica to come to that idea. But you can do a search here for all the symptoms of a remedy very quickly in the repertory. So you see, you put in just a few letters. It's okay, aurum muriaticum natrum, and then you can select the chapters, or if you leave it open, it will do all the chapters. You can select degrees, rubric size, but for now we'll just search for everything. And you see it's actually represented in the repertory quite strongly. And many symptoms which we may not know. And you see here ailments from disappointed love. So we can see and we can compare with aurum muriaticum. All three of these aurums have slightly differences, which we need to differentiate and know. Of course, we know about Ignatia and Natrium muriaticum and phosphoric acid. And we also see here uterine cancer. And actually, if you see on a very straightforward level, asking about why this remedy, if you look at just these two symptoms, which is the essence of her case, the cancer of the uterus and disappointed love, I believe here there's only really two remedies that have both these symptoms in any strong degree. And there's only one that has both symptoms in third degree, which is aurum muriaticum natrum. So you see it's that combination of this strong emotional causation and the pathology. Only one remedy. Otherwise, nature mur has both, you see. You don't see Ignatia in here. Aurum, okay, you see aurum, but in cancer, it's low down in it. So you see, on a simple level, you can see how this remedy fitted the case. And then, of course, in Compass, we have this great ability to just click on a remedy and immediately see the materia medica. But this is the materia medica, as you see here from Professor Vithoulkas' notes. You see, this is not available elsewhere. So this is very important, this idea of understanding the materia medica in essence. So just to show you that, I think it's important. So I have since spoken with this lady, and she's doing well, health-wise, generally good, and has come to peace with herself more now with what happened, yeah, all is good. So I hope that's of interest, and I think shows a rather unusual remedy, one that's not so well known. And again, a succession of remedies given Hepasulf, aurum muriaticum natrum, and then lachesis in that order. And then the way that her fever came back after the treatment, showing that she was now in a better level of health. And this is for us proof of the cure, if you like. The only unfortunate thing was that she had the hysterectomy in the end, which wasn't necessary, but anyway. Okay. So I think that's it. We now have some questions, I think, to answer. Maybe Elena can start us off. Elena, if you'd like to.
Yes, Andrew. First of all, congratulations for a fantastic case. And I'm not talking only on my behalf, but there are many, many attendees here and participants that, first of all, congratulations on a wonderful case. And I will now begin with some of the questions. So one of them is, the first one is from Eman Harun. And he asks, why did you start with hepar sulfur, although the first remedy is lycosis?
Yes. Well, the first remedy in the repertorization, that doesn't mean it's the first remedy. The repertorization is there to give us a guide as a choice of remedies, and then we differentiate. So I felt that remember at the time, she didn't have a confirmed diagnosis. It was mainly a period pain and change in her cycle, plus the anger and the aggression. So I decided on hepar sulf to start with, based on that and her fears.
Okay, so that answers the question also to Vlasta, who also was asking why was hepar needed in the beginning. So we've answered that. Now we have Anne, who asks, last time you mentioned with the case that causticum is often used in inflammatory bowel disease. In endometrial cases, do you have a higher proportion of cases requiring a particular remedy?
Well, I think, yes, I think that's possible. I think we need to do research on this, but if you took, a number of cases, a high number of cases and looked at it, you may well find that there are certain remedies that are used much more frequently. So I think there are affinities, of course, like this aurum muriaticum natrum has a strong affinity with the uterus and the hormonal system. So I would think it's a very important remedy in these cases. But of course, homeopathy is an individualized, differentiated therapy. So we can't say that there's a standardized remedy, but I think with the inflammatory bowel, it's just that I found personally that a lot of my cases that did really well needed causticum. That doesn't mean that it's the only remedy. Maybe I, for some reason, only saw caustic cases. Someone else may see lycosis cases.
Okay, so now we have Joanna, and she asks, why 1M and 10M given her level of health?
Yes, that was mainly because of the severity of her mental state. I felt it was clear and it was a strong mental state at the time. And she was getting into fights with people in the street. So this was very, needed some high potency in this case.
Okay. We have another question from Mirza Bilal Baig. And the question is, why aurum N in 12C?
In pathology, we need to use the lower potency more frequently repeated. So when there's pathology formed like a tumor, we need lower potencies repeated. We can use 6C, we can use 9C, 12C, 15C. I just chose 12C, yes. Also because the aurum muriaticum natrum didn't just cover the pathology, it covered her mental state. You saw the disappointed love and this idea. So it had some element related to the whole totality of the case, but I didn't want to go too high. So 12C is a good, 15C is a good medium.
Okay, now we have another question from Naima, who says, but what about the anger and the cursing, the fear of needles? Did you then consider those aspects to not be the central idea? Did you expect that later another remedy would take care of that?
Well, the hepar sulf took care of her aggression and cursing and the first prescription. the fear of needles and things, I didn't ask if that had gone. So that's a good question. Maybe over time that will have gone as well with that prescription. Yes, I didn't ask actually.
Okay. Then we have Lasta again, who asks, was HEPR needed in the beginning, or could we go straight to orum muriaticum natrum?
You could, and as I say, we don't know what would have happened. Actually, the pathology, the tumor was already there, so yes, you could. But will it have dealt with? You see, there's like in cases you have to look at the initial layer, the first layer on top. It may be a very small layer, but it needs to be the first remedy first. Then the rest works better, you see, but it's not to say it wouldn't work. I think it probably would have worked as well, but her mental state would have remained.
Okay, we have another question from Massimo, although I don't really understand what the question is. What do you mean for dose? Probably he asks what you give as a dose. What quantity of pills?
Oh, I don't remember what she took. She was abroad. I imagine she took just, if it was pills, 2 or 3 pills as a dose. Usually I take 2 pills. They're very small. Or it might be drops, 1 drop in water, something like this.
Okay, now we have another question from Dr. Premanand. I don't know whether I'm pronouncing the name correctly. And the question is as follows. Did she have a strong pain after lycosis? Could this indicate rupture of the chocolate cyst, which could explain the brownish discharge?
Did she have pain with it? Yes, good question. I imagine she did have some pain with that. I imagine that would be quite painful after the lycosis, yes.
Okay. And then
she didn't say, but certainly it came out, but presumably it must have been reasonably painful.
Okay, and Dr. Premanand goes on saying that the cysts may not get expelled through the vagina. Ruptured cysts can, however, discharge the fluid PV. And it's unfortunate that the patient underwent hysterectomy. She could have waited for some more time. Yeah. That's just, you know.
Yes, yeah. Well, the problem is there was tremendous pressure from herself and from the hospital, of course, because they said this is dangerous, you can't leave it, etc. So she, and I lost touch with her for 2 months. So she made this decision suddenly, and then, yeah.
Okay, so now we go to Emanuela, who says, the only connection between the ovaries and the vagina is through the fallopian tubes, which are a few millimeters wide. How did she expel the large chocolate cyst from the ovary through the vagina? And also, when did she have her hysterectomy?
Yeah, first, the answer to the first question is I don't know. Anatomically, I don't know how it's possible, but that's what happened. The hysterectomy we saw on the report was in February.
Okay. And then she goes on to say that ruptured ovarian cysts will most likely release the contents within the abdominal cavity rather than through the fallopian tubes. This is just, you know, an extra. So these are the basic questions that were asked. We have many participants who, well, actually quite a few participants thanking you. And we thank you as well for a fantastic case yet again. Well done, Andrew. It was really good. There are some other participants who would like to know how you got to do that search, which maybe, you know, they could communicate with Vithoulkas Compass and we can show you how Andrew got to do that search. To Rachel Jones, basically, she's asking, how did you get to do that search again? We can show you at another point. And basically, we're getting all kinds of thank you notes and thank you from in the chat for a very interesting case. So on my end, this is it about questions. Thank you, Andrew, and I pass you on to the president of the faculty.
Thank you, Elena.
Thank you very much. Thank you, Elena, and thank you, Andrew. Another really inspiring and encouraging case. Thank you. I was thinking that it was a good example of the integration of the conventional approach and the homeopathic approach. She was doing the investigations, she got a diagnosis, she was concerned about XYZ, but she was also seeking homeopathic treatment. And whilst we might disagree a little bit then with her ultimate choices, I think it was a good example actually of how homeopathy and conventional medicine can actually integrate. And I hope that it gets published soon, Andrew, because that's a great case. So thank you, everyone. It just remains for me to wrap up with a couple of closing slides. Thank you to Elena and Vithoulkas Compass. Please reach out to Elena if you're interested. That's the email address, iabati@vithoulkascompass.com, and you can discuss a free trial period, or 20% discount on the purchase of a subscription. And if you're a member of the Faculty of Homeopathy, you can avail of a 25% discount. Oh, back one slide. Yep, there we are. Thank you. And if you're not a member of the Faculty of Homeopathy, please drop us a line at info@facultyofhomeopathy.org if you're interested in becoming a member. As I said at the start, we are UK based, but we have members around the world, and it's been great to see so many on this call. I even see some of our Ukrainian friends, so I'll say a special wave out to them. Lovely to see you. Yes, please contact us if you'd like to be a member of the Faculty of Homeopathy, which affords various benefits, including more webinars, CPD, and subscription to the Homeopathy Journal, which is the only Medline listed journal in the world that's dedicated to homeopathy. So if you want to know what's happening in the homeopathic research world, that's the publication you want to be subscribed to. So please drop us a line about that. And save the date for our Faculty of Homeopathy 100th Congress. The Faculty of Homeopathy is one of the longest established homeopathy organizations in the world, having been established in 1844. So we're 178 years old. And around about 1850, we started to run congresses, and that's happened every year or so, intermittently since then. So the 100th of those is coming up next year in September in Cambridge here in the UK, face-to-face. So please mark that in your diary. It would be great to see you at that. And yeah, I just want to wrap up by thanking Andrew for another great presentation, another great case, which adds to the very many that's been presented this year. It's been great. And thank you to Vithoulkas Compass for the collaboration. And someone mentioned on the chat box about the recordings. There's no need for anyone to record this privately. All the recordings will be made available and are available on the YouTube channel. And this one, if you're on this call, you'll get an email in the not too distant future letting you know how you can access this recording. So thank you to everyone. I don't think I've much more to say, but it's been great to be on the call with so many people and with Andrew and Vithoulkas Compass. And I wish you all good health and good speed. Thank you.